Good afternoon and welcome to the Midday News for Wednesday, November 26. Special welcome to our viewers on YouTube, TVJ International in the Cayman Islands and online at onespotmedia.com. Here's what we have in the bulletin.
Government under pressure to disclose how disaster funds will be handled. Health Ministry confirms 3 of 6 suspected cases of leptospirosis. And later in sports, Mount Pleasant gets advantage with win in first leg of Caribbean Cup finals.
Thank you for joining us. I'm Carrie Simpson. Now the details. The public deserves to know words coming from civil society groups as they demand answers from the government about how disaster funds will be handled and whether the public will be shut out of critical decisions. Antonia Atkinson has our first story.
Anti-corruption watchdog National Integrity Action (NIA) says public participation must be treated as top priority as the nation confronts the fallout from the hurricane. Civil society groups argue that while the government holds primary responsibility for coordinating disaster response, independent bodies must be allowed to play an active role in monitoring how relief is administered. NIA Principal Director Daniel Archer spoke to those issues.
When we think about that opportunity for recovery and resilience, we now have to go down the line and ask ourselves, what's the denominator? What's the factor that we're not using as much as we should? And this is it. We're not using ourselves. So I passed the version of saying, what is the government doing? And how it is that they're not doing it, to saying, how can I capitalize on my own vision for what I want my community to be?
Adding to the pressure is the Jamaica Accountability Meter portal. JAMT Director Jeanette Calder also has questions about how accountable the government has been in the response and relief effort.
When will we see the data on the spending that has taken place so far, on the contracts that might have been awarded already? You do not need the government's permission to demand accountability. You do not need to wait on governments to set up the oversight committees. Guess what, folks? We are the committee.
JAMP is also recommending the creation of a public relief tracker, a simple tool they say would allow Jamaicans to follow how funds and resources are being allocated in real time.
We have our eyes, Anton, on a public hurricane relief tracker, where we're going to record every dollar announced, every contract awarded, every project started and completed, and every family that is still waiting for help. We're going to make it visual, make it shareable, and update it on a bi-weekly basis.
Both organizations argue that with millions of dollars in relief expected to flow into the recovery effort, strong oversight is the only way to prevent corruption, mismanagement, or political favoritism. Antonia Atkinson, TVJ News.
As of November 22, the country has recorded 10 confirmed cases of leptospirosis, including 3 deaths. Health Minister Dr. Christopher Tofton gave the update at Wednesday's media briefing at Jamaica House. Dr. Tofton is also adamant that the measures implemented by the ministry to address the aftermath of Hurricane Melissa have been working effectively so far.
As of this weekend, we will have 3 field hospitals set up. The last one being at Savlamar Hospital. Very sophisticated facilities that provide all the necessary services from diagnostics to lab to pharmacy to inpatient care, operating theatre, etc. We then moved into the primary facilities where we have attempted to restore services, if not the infrastructure, of our health centers. 101 health centers have been impacted in the zone of the storm. We have about 325 health centers in total, approximately 101 impacted in various ways. 25 or so badly damaged, either totally damaged or extensively damaged. As of now, the assessment is being done, similarly so with the hospitals, and bringing those back to a point where the services can be provided, even if in a makeshift facility, whether it's a tier 1 tent type health center or, as said earlier, the field hospital.
And the death toll from Hurricane Melissa, which devastated Jamaica last month as a Category 5 system, remains at 45. The Director General of ODPEM gave the latest update during the media briefing at Jamaica House this morning. He says recovery efforts are continuing across the island.
We are also providing necessary support to them during this difficult time. Today also, I wish to report that 16 persons remain missing. The JCF continues to work to find and reunite these Jamaicans with their families. To date, the JCF's efforts have reunited 18 persons with families. As we continue our efforts to ensure that aid is equitably distributed, we can report that this morning some 209,000 food packages have been delivered by the national system.
And a number of shelters have also been closed since the passage of Hurricane Melissa. But the ODPEM leadership says some persons are not returning to their communities.
As of 10 p.m. last evening, 113 shelters remain open, accommodating some 1,441 persons. The parish of Westmoreland continues to see the highest numbers of shelterees. To date, with the multi-agency support, the Ministry of Labour and Social Security has been able to complete over 22,000 Jamaica disaster needs and impact assessments, primarily in the most affected parishes of Western Jamaica. A significant effort is now underway from a multi-sectorial committee to ensure that all the necessary assessments will be completed in the coming weeks. Jamaica has made some significant efforts and progress in restoring utilities. Today, we can report that 76% of the JPS network is operational, with some 165,000 customers remaining without service. Almost 82% of the National Water Commission customers have been restored, leaving some 102,000 customers without supply. In order to bring safe water to this population, the NWC and partners have established significant distribution sites across Jamaica and have also been trucking water into the most affected communities.
The Ministry of Education says it is now assessing how best to accommodate students who were severely affected by the hurricane, but are also scheduled to sit upcoming regional exams. Alia Bryant has the details.
The Caribbean Examinations Council, CXC, has agreed to extend Jamaica's examination timetable. Education Minister Senator Dr. Dana Morris Dixon made the announcement in the Senate on Friday while addressing concerns on the impact of Hurricane Melissa.
So we will have a longer period. So our exams will be later than the other territories. So that's already in train. And next week, I will also be able to tell you about lower costs for CXC fees. We've been negotiating lower fees for our students.
Minister Dixon further updated the Senate on the status of primary exit profile exams.
We're looking at extending the dates for PEP. We've not made a final decision on PEP. That's why I have not said it yet, but we are going to have to extend the dates there.
She revealed the discussions are also advanced with the Caribbean Examinations Council to determine necessary relief, including adjustments to deadlines and requirements for school-based assessments, SBAs, and practical examinations.
Looking at how we can change the deadlines for those, and there is a lot of flexibility built in. We're also looking at flexibility in syllabus coverage and also cost implications. Also, provision of options for students who may want to reduce the number of exams they sit based on their situation.
As it relates to the National Vocational Qualification of Jamaica, NVQJ, the minister informed that examinations have been rescheduled.
Examinations are tentatively rescheduled for February 2026, with a further option in June 2026 to allow students and institutions adequate time to prepare. For City and Guilds, they have proposed a 2-cohort examination model with sittings in June and November 2026, offering increased flexibility for schools in the most severely impacted regions. So we're working with our primary external partners to ease the burden on our children as best as possible.
Alia Bryant, TVJ News.
It is time for a break. Stay with us, more stories when we return. Welcome back to the Midday News. It is now time for the Business Minute.
BOJ Governor Richard Balz says commercial banking services, including access to cash, were badly impacted by the hurricane. But he was quick to point out that financial stability remains a top priority for the central bank. The governor said in a video statement that the bank understands that more Jamaicans will be reliant on cash in order to conduct their daily transactions in the aftermath of the hurricane. Further afield, some boar's head-labeled food items have been recalled due to a risk of bacterial contamination. According to a notice from the Embryola Company, the recall is tied to some of its Pecorino Romano cheese products that could potentially contain listeria. The company distributes some of the cheese under the Boar's Head brand. The recall includes cheese sold in 6-ounce containers. 2 prepackaged deli items under the recall are the Ever-Roast Chicken Caesar Salad and Chicken Caesar Wrap. The products were sold at Kroger grocery stores in Kentucky and Indiana. So far, there are no reports of anyone getting sick. And that's it for the Business Minute.
Thank you, Andrea. And here's a preview of what's coming up in this evening's Health Report.
In this evening's health report, we'll look at leptospirosis.
Certain environmental conditions certainly predispose you to it. So conditions in which you have pools of water after, say, flooding, or in our environment where we have hurricanes associated with flooding, then yes, it is expected that you're going to see a spike or potentially see a spike in cases of leptospirosis, because we know the bacteria exists in the animals that we have around us. And from time to time, we do see cases of leptospirosis under normal circumstances.
That's the health report in Primetime News at 7. And you know, for today's healthy living tip, avoid contact with contaminated water. Wear protective clothing. Maintain proper sanitation. Control rodents. Treat cuts and wounds promptly. And seek early medical attention.
Time now for the top regional and international stories.
In the region, the Guyana Geology and Mines Commission GGMC is warning miners to follow the law or face tough enforcement. The reminder comes after President Irfan Ali signaled action against operations breaching mining regulations, including poor gold reporting and environmental abuse. GGMC Commissioner Noel Denninson says all miners must secure proper documentation and sell gold only to authorized buyers. He says low gold declarations remain a concern, and the Commission will ramp up efforts to tackle illegal activity in the sector. And on the international scene, more than a dozen people are dead and others trapped after a massive fire broke out in a high-rise housing complex in Hong Kong Wednesday. The fire reportedly spread along bamboo scaffolding on the exterior of the building, trapping residents inside. Emergency services rushed to the scene to rescue those caught in the blaze. Now authorities say the death toll could rise as investigations continue. And those were the top regional and international stories. I'm Aliyah Bryant.
Thank you, Alia. We now head to a quick break. When we come back, we'll have your Midday Sports Report.